voilà, quand nous rentrons dans notre deuxième partie, Topik Konversasyon, pour la bon matin, pareil, moi, dit, nous réaccueillons Dr. Suganya, Saravanakumar, qui nous a aujourd'hui bon matin. Quand nous continuons une conversation, nous continuons le IVF, pareil, qu'on est IVF, il y a un gros sujet dans lui-même, quand nous, madame, nous concernons, nous causons, madame, IVF, il y a un gros sujet. Alors, aujourd'hui, nous pas prendre un petit peu, le qui moyen, nous pas prendre son basics lui-même à cause du gros, nous pas capable de pour dire, il y a quelque chose qui est simple, il y en a différents steps qui viennent avec pour nous capables de dire, nous faire la réussite pour IVF. Et aujourd'hui, nous pouvons prendre ça différents steps. Alors, ça madame, là, aujourd'hui, bon matin, restez très attentifs à cause de Dr. Suganya. Il nous raisonnement encore. Welcome back, bonjour.
Bonjour, 𝐃𝐫, comment vous ça va?
Moi bien, merci. Ben, comment ça va?
Moi bien, merci. Dormez bien?
Vous dormez bien?
Yeah,
tout quelque chose passe bien pendant la nuit?
Yeah.
Quand tu arrives, c'est là?
En Sunday.
Dimanche?
Dimanche.
De la pluie?
Yeah.
Tu es dans la pluie dimanche?
Yeah, tu es dans la pluie.
Tu es dans la pluie?
Yeah.
Et docteur, bien sûr, par l'habitude, nous réaccueillons et nous pouvons cause de IVF. Par nous dit, il y a un gros sujet. Docteur, il y a pas de créole bien même que pour moi, hein?
Yeah, I can apprendre créole, but I can answer in English. I can
IVF,
understand.
we are talking about to make our women understand the basics of IVF. We have addressed these subjects before, but now we have to make out the women of Seychelles to understand the basics, that it's not that simple just to go and conceive.
Yeah.
There is steps.
Very true, 𝐃𝐫. Thank you for highlighting on this particular notion. Everybody has got a global idea that IVF is the last hope for them to conceive. There is no doubt about it. People can conceive who are waiting for long years. IVF is a boon. But the key behind the IVF is proper preparation of the lady as well as the partner before recruiting the eggs or the sperm. Without proper preparation, there seems to be a lot of aneuploidy or dead eggs inside. Imagine like the hens are laying a lot of eggs, and when we are made to breed them into chicks, when you know the good old style where the mother hen is made to sit on 12 eggs or 13 eggs on a chicks to produce chicks, on the 18th day, not all turn out to be the chicks.
Yes.
One or two, they just go away just like that, rotten. So here the key is, when we are targeting embryos, we need to do the homework properly. The groundwork of preparing the lady, starting from her blood analysis, hormonal analysis, local examination, how is the condition of the uterus, condition of the ovaries, what is the capacity of the ovaries to release eggs, how many number of eggs can be targeted, and if we have any hiccups in the above area, then we need to really address on those particular issues. Coming to the partner, it is neither different. Attend the quality of the sperms, number of sperms, the motility of the sperms, the anatomy of the sperms, the morphology, the head, the body, the tail, everything. So, all these are to be analyzed, and then they are assigned together for this IVF. The IVF actually happens in two different processes, not on the go. The patience here is the key. The main virtue is patience. When they come over there, they can get prepared for egg collection, which average on a duration takes about 3 weeks. But that is a max of 3 weeks. I can assure you it can be done in 2 weeks, less than 15 days. But if it is properly, that's again I am emphasizing the groundwork or the homework that we really need to do to prepare the eggs. If it is done properly, then their stay is required only for 15 days. On the other hand, the partners stay, if they are comfortable with their wife stay throughout the period, they are most welcome, because the emotional support the lady requires during the process, because it's all to do with medicines, injections. And repeated ultrasonography, repeated evaluations and all such. So, if they are accompanying their partner, it's wonderful. If their work pattern doesn't allow them, then they can take a minimum of 5 days or 3 days, it's max, when they can come over there, fly, go for an analysis, select the sperms, and then we can process it further. This is phase 1. There is phase 2. That is a bigger process.
But do you recommend for the partner to accompany the other partner?
Always, 𝐃𝐫. because irrespective of the physiological contribution, the sperm contribution, the men's presence make a huge difference on the lady mindset, because stuck on 4 walls thinking about what is going to happen, every day injections are being given. So, this is something like when the partner is there, they have a good understanding, the bonding becomes better, and they are able to discuss about the outcome of the process they are going through. Just in case if I have to address them, the process number of eggs are this low or this high, it is equal, both of them, it is on an open plate, they can understand. So, this is what is been we are getting. So, let us expect this results. On the other hand, if the lady travels alone, and what if her egg collection is very marginal, and here the partner is like too much anxious, why it is not materializing after all the injections, they can really never understand over the telecall or over the conversation. So, it is always better to go along with the partner and then take care of it.
Merci Madame Mademoiselle, aujourd'hui nous pouvons cause IVF from egg to baby, par exemple, on dit yes, 𝐓𝐶𝐳 qui nous a abordé, mais souvent nous continuons avec ça. Now, doctor, a family of 3, a mother above 45 years old, the husband above 50 years old, they already have 1 child, and what if the mother wants to have another child? What is the capacities? What is the success rate?
Yeah, wanting children is always not restricted to age, Carol. Even at the age of 60, I can want another baby. Babies are, they are just God's miracles. So, this are coming scientifically. Above 45 years, the lady has to undergo a lot of hormonal tests to see what is the egg quality. And for the male partner, 55 is the last age where he can contribute the sperm. 50, now it has been marginal. Now 55 is the deadline.
He's not weak?
No, he is not weak. Technically speaking, no. Male partners are very good. The sperm count releases every 90 days. So, need not worry about the sperm. But first a sperm analysis has to be done. The partner, what are the habits of the partner, say like smoking, alcohol, stress, obesity, diabetes, what not factors are contributing to the sperm quality. If the sperm quality is good to go on the tick, then they are good for the 4th baby if they wish to.
Really?
Yeah.
Voilà, un petit peu. Bon, qui parle à 45 ans, bon madame, bon monsieur, parle à 51 ans, si vous avez envie encore bon enfants, oui, il y en a une possibilité pour in vitro fertilization par une cause là, docteur, il expliquait the success rate are 90%. 90%.
To be honest, I will tell you, it is 99% if the homework is done properly.
Yeah.
Because we are able to, that's what I will want to discuss in phase 2. You do the homework properly, we get good embryos, it is not at all, because the homework is done. The eggs quality has been improved with medication, the stress level of the partners are brought down, and they are given a very comfort zone where they are able to analyze what they are going through. Phase 1 is 99% positive. It is never, the 1% is because the partners didn't cooperate for the proper treatment. Otherwise, we are very good in the first half, or the phase 1 is 99% through.
For the phase 1, doctor, somebody is asking what is the age limit for the treatment?
Age limit, if she is a lady, she can opt for treatment less than 50 years of age. If the person questioning is a man, then he can opt for sperm at 55 years last. He should be 55 years and the lady should be 50.
Not above?
Not above. Not above, the government doesn't allow the egg release or the sperm collection. No, the dead end is 50 and 55.
Now, doctor, last time we were talking about IVF and the treatment. You can hear.
And sorry to interrupt. Reason behind the 50 and 55. It is not that we want to be stringent about the age. Government has analyzed lot of protocols. What if a 50-year-old lady conceives and then gives birth? What are all the complications associated? What is the medical problem she will be facing when she is pregnant? And after 55 years, the sperm quality, what is the quality? This is a lot of studies that happen, and finally they have arrived at a mean age of 50 and 55.
Voilà, la réponse pour votre question aujourd'hui bon matin. Now, in phase 1,
yes,
what are the side effects?
Side effects in phase 1, actually to be honest, let me be very honest here.
Be very honest to the people of Seychelles.
Number one, it is not so a cakewalk there. It's definitely going to be painful. Number one, anxiousness is rocket high. What they're going to mean?
Rocket high?
Rocket high, yes. Stress and anxiousness is a rocket high. And we need to cool them, calm them down, tell them that every time this is the procedure which we are going to do. Quiet, we stay quiet. And on the second day, they will be given a ultrasound. Based on the ultrasound, she will be given injections. The injections part will happen for 7 days, which is the most painful zone according to anybody. But if you understand the theory behind what it is, you get used to it. Only day 1 of injection is going to be, that's all a very small needle prick like that of a tiny baby needles. And then we directly opt for, I think the previous slide. Yeah, and then we directly opt for egg collection. After the egg that has been collected, this is the fertilization we put, the sperm crossing the egg and then it lands up in fertilization. It is very, very, very innovative, creative step where we need maximum control of the environment, including the atmospheric oxygen level.
I want to talk about the atmosphere.
Atmosphere, yes. Exactly. The weather condition needs to be crisscross perfect. There is no doubt about it. The atmospheric oxygen level, the humidity, the carbon dioxide level, the nitrous level, everything in the air is checked before the eggs are taken out and the sperms are retrieved and fertilization is processed. And once fertilization, say for example, if we are able to collect on an average, Carol, I can tell a good fertile woman can yield up to 15 eggs on a proper stimulation. But of the 15, the ones which are really, really good enough are 50%. Maybe we can target 7 eggs. Even in those 7 eggs, we have a very good ratio that they can have triplets, they can have twins.
Triplets or twins, I was going to say that in that 7 active ones.
Yeah.
Triplets or twins.
Triplets are quite common. Yeah, multiple pregnancies are very common in IVF. And what happens is, like when we thaw them, we make them in particular containers, so the grades of the division is put in particular trays. So when they want the transfer to happen, we are given enough time for the cells to divide on the same growth.
On the same growth. Let's talk about the time frame. Transferring the sperm.
Of transferring the sperm.
Yes.
Once the eggs are collected, half an hour before the partner's sperms are collected. Processed and pick the best ones based upon the number of eggs, 6 or 8 or 15. The 15 sperms are isolated. So, of the 15 sperms, we pick the best one with best motility and go for the best quality egg, fuse it together, put it aside. It is a big work. Of the 15, both goes together. Always the procedure is fusing the sperms and making the babies form. This is step 1. And the worst case scenario, if the eggs are not showing any division, or like dormant stage, it is about to divide, not yet. You know what it is like? It is about to, but
what happens now?
Now we freeze the egg and we freeze the sperm. After 3 days, we retrieve, we see what the eggs are, whether they are positive. If they are positive, then we go for a division again. Otherwise, if the partner is not able to fly frequently to India or to place where he is opted for IVF, the facility of sperm freezing is available, where he can freeze his sperms for 5 years, 10 years, 10-year period. That is one technology the medical field has advanced. Yeah, the quality of the sperms of the 100% can go down to 97% because it's been there for long shelf life. But the quality of the eggs, the embryos the eggs can also be freezed. If that's the case, if the mother wants to freeze the eggs for future consumption, we much not recommend it because it is halved.
I was going to ask you, is it recommended?
No, because the quality goes there, 50%. The eggs are the most fragile and most nutrient one needed. So, the capacity of the egg that will be saved and turns out to be a normal one will be halved. So, rare case scenario like cancer patient, terminally ill patient, stroke or medical disorders where they are not able to come back and forth, then we opt them for the egg freezing, and then we prepare the embryo. Egg freezing is much better.
Doctor, I know we've talked about this each time you come. You cannot do this here in Seychelles. The ladies have to travel. The pairs have to travel.
Yes,
they
pairs
still have to travel.
They still have to travel, and that is where I really want to emphasize, Carol. Traveling to Chennai in my place, Sugan Hospital, we do it everything, picking up for the partners from the airport. Everything is all the same. The process where I am feeling the hiccup is, if I am rushed, then I am not able to. Then the results can be compensated. So, I am always telling them calm, quiet, and then your results are positive. So, when they are anxious or nervous, then we take 2-3 days to settle down them. So, it is not on the go, they come, they give the eggs, it is not like that. In Sugan Hospital, in Sugan Hospital, first 3 days just quiet, calm, enjoy the place of stay, look around, get accustomed, because any level of stress, cortisol, steroids is going to damage the eggs there on the go. So, if that is the case, then there is no point in collecting eggs and collecting sperms landing up in dead ones. So, we make them very comfortable and then we target for the egg collection.
In other words, you are saying the traveling duration, it's 2 or 3 weeks.
Yes, for maximum. the lady 15, let me be very precise, 15 days.
15 days.
Yeah, for the men it is 3 to 5 days.
3 to 5 days. 15 days, the first 3 days is resting.
Yeah.
For the
3
ladies.
days, resting, absolute resting phase where she is getting used to our system, people, the staffs or the first meds who are all attending. So, there is no panic button, no gas lights on. So, in that is the case, then we are targeting good egg. Rushing directly to the theatre, preparing everything, then the results are not very.
It will not be successful.
No. The steroids does the total damage there. The steroids does the work for you. They just kill it.
Bonne madame, c'est notre écoute nous là aujourd'hui bon matin. Oui, nous avons besoin continuer à Chennai, côté Sugan Hospital pour autres faire ça. Docteur dit maximum 15 jours pour bonne madame, même pour bonne monsieur environ une semaine et pour un maximum pour autres capable faire un traitement pour in vitro fertilization si vous pouvez considérer pour gagner encore un enfant. Now, let's go to the phase 2.
Yes, please.
Yes.
I'm waiting for that.
Yes. Your favorite part.
Yeah, because phase 1 everybody Googles and then you have lot of information about phase 1, but not about phase 2.
Yes.
This embryo transfer is very tricky, Carol. What happens is 1 month of gap is given compulsorily for the lady to restore her health back. Think practically, she has been given hormones, she has been given injections, she has been given what not medicines to boost her eggs up. So, all the toxins has to go away from her body. So, 1 month of rest according to my protocol is mandatory for the lady. So, the lady has to rest well, eat healthy diet, stay away from alcohol, having thought that the part is over, not to party again. So, stay away from alcohol, eat lot of greens and veggies, drink lot of water, and fitness routine please to be implemented. The toxins are let out faster when you are exercising a little bit. So, this is as per for the partner.
No smoking.
No smoking, no alcohol, please. No smoking.
Let us be clear. No smoking, no alcohol
No
at all.
smoking, no alcohol, please. It is going to damage whatever process they have taken all the time. And 1 month of gap. After that, the cycles has to be monitored, the period has to be monitored. And once the periods are monitored, the male partner is well informed that this time if they are both willing to travel, welcome. If not, the lady alone can come back to the same place on her first day of period, and we monitor around 15th day we can see the result. The transfer will happen on 10th to 12th day or 13th day at the max. Let us say 2 weeks. Let's say 2 weeks.
What will happen if after the 15th day there's no change?
No. Please don't take me wrong. It is like for in the first 2 weeks she will be monitored, given tablets. This time no injections, only tablets. To prepare her uterine bed and to receive the baby. So once the process is done, that will be roughly on the 13th to 15th day. But here I am pleading to all mothers to be. Once, what is the thought is like they have got the baby inside and then they want to take the flight immediately. I need to give them proper rest for another 15 days. On 15 days, we need to give them injections, monitor them, make the baby, see we have put something inside the uterus and it will be moving somewhere inside. You know, the embryos has the capacity to move like a tadpole, and when it moves, and those are the early cell division what we are seeing.
Yes.
The last one is the one where we are supposed to collect it for thawing, the last one I suppose. Yeah, day 6 or day 9, that will be the early blastocyst that will happen when the baby is placed inside the uterus. So, at this stage when they are traveling, there is every chance of miscarriage. So, we need to wait for the blastocyst implant. You see the last slide is about the 8 cell growth is very good, and after that the blastocyst, the last one helps the baby. In fact, that is the truth. Yeah, and the next slide please, if they have. Yeah, day 5 blastocyst. This is the stage where the inner cell mass is the baby, the outer one is the placenta, and the best stage for transfer. This blastocyst will give you best results, but for that they need to stay with us for 15 days. Because I can put the blastocyst day 5 inside the uterus, but what really matters is whether the cells from the placenta release and protrude like roots and finds it, it should branch out and should get glued to the uterus.
So it's best that they stay for another 15 days.
Yes.
To be sure.
To be very sure. If they are very concerned about fertility and the baby and the family, please rest with us for a month for phase 2. Phase 1, 2 weeks. Phase 2.
Plus 2 weeks.
Phase 1 is only 2 weeks. Phase 2 is 1 month. Solid 1 month.
Solid 1 month.
Yeah. When on the 15th day after the transfer, when we check for the baby, and if we can find out that now the baby has crossed the dangerous zone, because we have allowed enough branching and rooting of the blastocyst or of the baby. So, this is the hiccup I face it when I treat overseas couples. Yeah, cross-border reproductive care, where I am finding this is the problem. They want to get back to work. They give me too many reasons, like convince me like I have to go to work, I don't have leave.
Yes.
Then what do I do?
It's quite a bit much, because many people don't have that much of annual leaves.
Yeah.
Yes.
So, that is in that way they can plan it. The first phase can be done when they are having in the first half, and the second phase when they are given enough leave in the second half. This need not be done in a month scale only. The embryos can stay with us for 8 months, 1 year, what not, but plan it so that there is no stress, and then you get the baby, come out of the baby.
E pri bon, zot plan, zot konze, arrangement, quelque chose qui moyen, yete, surtout si on n'a pas beaucoup conseillé chez Madame Dr. Suganya, il a depuis hier inséré sa semaine et il basé côté Dr. Mouti et Suganya, sous envie, gagner contact avec Dr. Suganya, donne un petit call au mien, walk-in, que Dr. Mouti Ward ou rendez-vous, comme ça, on est capable de prendre une première consultation pour faire IVF. You offer consultation here.
Yes, we offer consultation for IVF, and above that, as the video clip showed, we are doing IUI also, intrauterine insemination. This is one step prior to IVF. IVF is like the conditions and criteria are totally different. In IUI, if the male partner's sperm quality or quantity is less, then we collect it, process it, make it into a small pellet rich in sperms, and we monitor the lady's egg growth, and based upon the egg growth, we place this sperm directly inside the uterus, and that gives very best results when done very carefully under proper monitoring. The lady has to have her regular gynae visits from day 3, 5, 7, 9, 11, and then the sperms has to be of very good quality, and if the quality of the sperms quantity is less than 20 million, then they are the ideal candidates for IUI. And we are doing IUI here in Seychelles.
You are giving it?
Yeah, we are doing
good
here
news.
in Seychelles at Dr. Murthy's. So, number of IUIs that can be tried before opting for IVF is max of 4. On the 4th cycle, we will be come to a overall understanding what is the problem, where is the hiccup, and the best results you can expect in 2 to 3 cycles.
So we have 2 options.
Yeah.
IUI or IVF?
Yeah, the criteria is totally different for IVF, and the criteria for IUI is totally different. I will tell the criteria for IUI: young, less than 35 years, less than 30 years, menstruating regularly, has got very good ovulation track, menstrual calendars are perfect, no tubal blockage, the uterus is clean, no fibroids, and the cervix is very clean. These are the female factors. For the male factors, again the sperm quantity, if it is less than 20 million, we go for IUI, less than 10 million, do not go for IUI, we are going to get negative results. So, 10 to 25 million with less motility, with less morphological defect, and men with difficulty in erectile dysfunction, where they are not in sexual activity, where they are not able to do a proper intercourse, and they are the very ideal candidate for this IUI, because erectile dysfunction is something to do with psychological. So, premature ejaculation where the sperms come out before even they attempt insertion. So, all these are the criteria for male factors opting for IUI, and here in Dr. Murthy's we are doing this in a state of art, because this IUI can be done just by filtering, processing, condensing. If the video can be played again, I can be able to emphasize on where the difference happens. Can the video short clip can be played? Do we have time? If there, yeah. So, in that I can tell you there is a screen. There is a screen. The microscope is connected to a TV monitor, where the monitor shows the number of sperms that are swimming.
Yeah. But doctor, there is one question from our viewers. If the sexual intercourse is very minimal, like once in 2 months, what will happen?
Sexual intercourse once in 2 months, if she is lucky, if it is her ovulation day, the chance of conception is high. Otherwise, very less frequent sexual activity is never helping the couples to conceive. And second, dryness of the vagina eventually happens if there is no sexual
going to talk about dryness of the vagina.
Dryness of the vagina is going to eventually happen because there is no enough lubrication coming due to sexual activity or due to self excitement. So, when these both target together, we are going to have burning sensation when you attempt a sexual activity after 2 months, that is going to cause even more psychological damage to both the partners, relating to the time that we have not contacted for so many months, and yet you complain of pain. So, that is the factor. So, have a good sexual activity life, a balanced one, so that irrespective of the child or the child planning or family planning, a good sexual and family balancing is needed for a healthy mind as well.
Voilà, un petit peu. Bonne question. Docteur peut répondre à votre question aujourd'hui, bon matin now. After the 1 month,
yes.
Do you still monitor until
no, after 1 month they can fly back here.
They can fly back.
They can fly, and then we can monitor here in Dr. Murthy's, a regular. And the delivery can be planned as a normal vaginal delivery, need not be a C-section. IVF is never an indication for cesarean section. It is considered as a normal pregnancy, it is normal growth phase, be it single or be it twins. Either way, that is the embryo transfer which we are seeing. placing the white line inside the I don't know whether it is able to made out, a bunch or a black ball is seen, and the black ball inside a white line catheter,
Yes.
and that carries the embryo inside. We place usually a single one, but regarding the quality of the embryo, if the embryos are good, then we place only one embryo. If the embryos are A and B grade, then we place 2 to 3 embryos, and it is absolutely a painless procedure. You do not even require anesthesia.
I was going to ask if this is painful.
No, you do not even require anesthesia, just a full bladder is more than enough, and it is very comfortable. Maybe when it is done by me, I always tell my couples, with me no pain. I explain them what is the pain. Once you give them the insight, this is the discomfort, this is the level of discomfort you are going to experience. I do not think they scream out of pain, they are able to tolerate pain. Only thing is the understanding and insight about pain is what is needed.
Doctor, I know this question was coming. The big question is here from our viewers. Let's talk about pricing, because we have talked of stage 1 is the first 2 weeks,
yeah,
and stage 2 it's another 1 month, quite
yes,
costly, and plus the airfares and accommodation.
Yeah, Carol, pricing I think need not be discussed on this platform. They can call me up. Yeah, they can. This depends upon number of injections or number of treatment scales one requires for egg stimulation. It is not like on a package I go pay this much and then you get the results. It varies from person to person. Yes, I definitely agree. It is not a easy procedure. You need to save money. It's a big procedure, but worth it. But on the flip side, staying over there is taken care of, including the procedure package. Only the airfares and the procedure has to be done by the couples. We are not asking them to look out for places. We are giving a very good guest house and a place to stay with a reasonably decent quality of life and food. We take very good care. Tu quelque chose pour qu'il y ait confiance de moi, Cara.
Alors, docteur, because I'm sûr que tout quelque chose pour que on a confiance avec docteur Suganya et puis on a son petit guest house là-bas quand vous caressez durant ça un mois qui ou d'un traitement after delivery.
Yeah.
Let's say it's a normal delivery.
Yes, it's a normal delivery after IVF.
What will happen to the child?
Very normal. Very normal. That is the stigma here. Everybody consumes that or presumes that IVF.
Triplets.
Yeah, IVF triplets. Yeah, that was our one. Yeah. Triplets. Yeah, 3 in and 3 out. All are of very good quality, and they are now weighing very. I think they are 6 months old now.
The 3 of them?
Yeah, all 3
they are
together.
6 months old?
Yeah.
Oh my God.
We started in April and we gave them, and now they are 6 months.
Oh, really?
Yeah. So what happens is they all gave birth by vaginal delivery because they are very small. We need not opt for triplets for an C-section. They are very small, and when they were born, they were hardly weighing 1.7 kg, 1.8 kg, and we were able to give them a proper NICU setup, and after that recovery from the NICU setup. They are treated like a very normal baby. IVF is nothing, not a taboo to be considered that it is an artificial robotic cells. No, they are their cells, the mother's cells and the father's cells. That cells are trying to bud outside, and once they are inside the womb, they are again budding faster. So this is how we look upon, not like any strange object trying to divide inside. They are very normal, very emotional, like a normal baby.
Like
They are very, very much like a normal baby. In fact, you will enjoy with them much more because you see, you are you're able to see the cells divided and grown up into a baby. It gives you an awesome feel on that.
This is the reason why some mothers called those babies lucky.
Lucky,
or
very
chance.
lucky. Very
the
lucky.
names are lucky or chance or hope.
Oh, hope, miracles.
Yes.
Miracles. They call them miracle. We call them miracles because we have 8 embryos divided, but of the 8 we see 3 only making it up. So they are miracles.
They are miracles.
They are very true,
indeed.
truly.
C'est Madanm 𝐓𝐨 𝐩𝐤𝐤 𝐊𝐨𝐧𝐯 Saravanakumar. Écoute Dr. Mouti depuis hier, un seul trait until
Until Friday here.
Friday.
Until Friday. Mo pevini sesal in Jan 11/6, 2026.
Le 26 janvier?
Zabia.
Le 26 janvier, et pour retourner encore à Seychelles, you're going for Christmas holidays.
Yes, we do celebrate Christmas there, and it's Christmas season everywhere.
Jingle bells everywhere. Now, Doctor, before we conclude, since yesterday until Friday, now convince those people watching us this morning at home, those who want to consider an IVF.
Yes, please, I'm always here. I'm here in Dr. Murthy's clinic from morning 8 to evening 5. Please approach me for all your queries. And to all the ladies out there, IVF is a boon granted to us. When we are given something, a boon, let us try, knock the door and try. And without trying, how will we know the success rate? Once you try, we will know what is the factor, where we are lacking, and finally, maybe we will be able to, I'm here to help you all. And trust me, Carol, when I say this, it's been 2.5 years I came to Seychelles, and every time I walk in, I see different kind of problems, different kind of fibroids, PCOS, menorrhagia, painful sex, early teenage pregnancies, lot of things we have been discussed on the same platform. And I am stepping into this IVF also to give the people of Seychelles the best result and at the best available cost I have. Cost comes next to everybody of my patients I tell, or my couples I tell, we don't work for money, we work for the heart. So when you work from here, you are able to deliver good results. And above all, trust the process, be very patient, don't rush. And the excitement can be, okay, after you conceive, when you see the double line, please catch the excitement. Until then, allow the process to happen, not to panic. And this is the only message out there. Every mother or every lady out there, you have the right to become pregnant. Pregnancy is a boon. Feeling of motherhood is an absolute boon. And when you see the baby kicking in your tummy, that is the life you have lived for the whole period. That can never be recuperated in any other forms.
Je vais demander aujourd'hui bon matin, Dr. Suganya, qui se cause avec nous IVF. Il est là depuis hier, jusqu'à vendredi, et pareil, il dit, il pourrait tourner à partir de janvier, mais ça semaine, nous sommes capables de contact avec lui. Donc, un petit corps que Dr. Murthy met tout appointement, sinon capable de working, et docteur va faire consultation avec vous, bonne coupe qui peut considérer pour allo IVF qui a envie de gagner un lot d'enfants. Docteur, merci beaucoup.
Merci,
pour faire le temps pour venir joindre aujourd'hui bon matin.
Yeah, before I conclude, Carol, having heard from you, this is when 𝐓𝐸𝐻 of every month is considered as fight against domestic violence. And so we are here as women, yes, let's fight domestic violence against men. Put up a proud face. Say, yes, we are here.
Be proud.
Yes, we are here not to get beaten up. We live up our heads high.
And wear orange.
Yeah.
In solidarity of the abused woman.
Yeah.
Doctor, thank you so much. Merci beaucoup. Bon courage pour sa semaine.
Merci beaucoup. Merci beaucoup from the heart. This is Dr. Suganya Saravanakumar signing off from Sugan Hospital, Chennai.
Et ça aussi, c'est le topic conversation.